Right, in this session we're looking at the muscles of the hip and thigh. We won't be looking at the quads and hamstrings in this session because those muscles cross both the hip and the knee, and we'll reserve that for when we look at the lower leg. The first group of muscles we'll address is the iliopsoas. This muscle is actually a combination of two, the iliacus and psoas major. Its origin is quite broad. The superior 2/3 of the iliac crest and fossa, superior and lateral region of the sacrum, and T12 to L5. It inserts at the lesser trochanter on the femur. Its action is flexion, but flexion of the thigh at the hip when the trunk is fixed, or flexion of the trunk at the hip when the thigh is fixed. That may sound very confusing, but if you actually do those actions, it will make sense. In the posterior aspect, we can now see we've got our gluteal muscles. Gluteus Maximus is on the posterior surface from the iliac crest to the posterior superior spine. The lower sacrum, the coccyx, and ends on the gluteal tuberosity of the femur. It has three actions. Gluteus Medius is in the middle of glute max and glute min. It originates on the lateral surface of the ilium, just inferior to the crest, and inserts on the lateral surface of the greater trochanter. It has two actions. Glute minimus is the smallest of the three gluteal muscles. We can't see it on this model. It has the same origin as glute med, but inserts on the anterior border of the greater trochanter. It has two actions. The lateral rotators are a group of 6 small muscles of the hip, which all laterally rotate the femur at the hip joint. They start from the posterior portions of the ischium, sacrum, and obturator foramen, and insert onto and around the greater trochanter. I've already provided you with their action. Moving anteriorly now, we can see the pectineus muscle. Pectineus originates from the superior ramus of the pubis and inserts into the pectineal line of the femur between the lesser trochanter and the linea aspera. Rotating our model now to look at the medial aspect, we can see our adductor muscles. Adductor longus originates from the pubic bone, the body and the inferior ramus of the pubis, and inserts on the middle 1/3 of the linea aspera of the femur. It has three actions. Rotating more now to the medial aspect, we can identify Adductor Magnus. It originates from the inferior ramus of the pubis, ischium and ischial tuberosity, and inserts along the length of the linea aspera, the gluteal tuberosity, and the lateral ridge of the medial condyle. It has three actions. Adductor brevis we cannot see on this model. However, it originates from the inferior ramus of the pubis and inserts at the superior half of the linea aspera of the femur. It has one action, which is in its name. From this medial aspect, we can also identify the most medial muscle of the thigh, Gracilis. It originates on the body and inferior ramus of the pubis and inserts on the medial surface of the tibia. Sartorius is the longest muscle in the body. It originates on the anterior superior iliac spine and inserts on the medial surface of the proximal tibia. Moving our model now to the lateral aspect, we can see Tensor fascia latae. It is a small muscle originating on the anterolateral border of the iliac crest, anterior superior iliac spine, and inserts into the lateral condyle of the tibia via the iliotibial band. The iliotibial band is also known as the ITB. It is a strong tract of fibrous connective tissue running from the crest of the ilium inferiorly all the way down, inserting onto the distal femur and proximal tibia.